another question would be like, do patients ever ask, hey, am I going to get a placebo? Like, am I really going to get like the real treatment? And then what's the kind of fear that they express of like not knowing what this medicine is going to do to their bodies?
Yeah, so you do get that, and I think that's one of the things that you have to be really careful of when you make the consent process, is that you're saying we can't guarantee that you'll get either the active treatment or the placebo, or indeed whatever other control you have, because not all control treatments are placebos. So to give an example, we had a trial in our hospital that tried to compare two different types of spinal surgery, and one you do from the front and one you do from the back. So it's very difficult to, you can't pretend that you don't know which one you got.
Mm-hmm.
So it's really important that you make it clear that at this point in time, we don't know which one's better. We don't know, which the better option is. Of course, the investigator for the trial has a preference, but if they knew, we wouldn't be doing the trial. So,
Right.
and how you communicate that individually, everybody has their own way of doing that. But it's I guess one of the things you want to move away from is this idea that a clinical trial is going to give you access to treatment that wouldn't be available otherwise. That's true. You do get treatments that you wouldn't routinely do, but that doesn't necessarily mean they're better. What is true is that, for example, because of the added scrutiny, you might very well get some very, very detail-orientated care. So it's tricky, isn't it? You have this idea going into trial, well, I'm going to get this brand new treatment and it's going to make everything better. And you see that in TV shows and movies. And that's another misconception that, is maybe not talked about as much, because some people probably find it useful for it to exist. But that said, it can happen, absolutely. There have been trials that have been so successful they got stopped early because of how much of a difference they made.
Wow.
And that is another example of the scrutiny I was alluding to earlier, right? Like, if your treatment is so good that it's obvious before the trial's over that it's better than whatever else you're doing, you're going to stop that trial and you're going to put as many people on that treatment as you can. And that's
Right.
that.
Wow. Well, tell me this. What are some of the obstacles that clinicians find when trying to get the patients into trials? Because it kind of sounds like to me like with the criteria, with all, the patient has to have the right genetic mutation or the right this or that. It's almost like uh you know a speed dating thing, and like, oh my god, will I get chosen or will I get rejected? Like, how do clinicians handle that?
Yeah, that's a really nice analogy. I think patient selection is a huge part of it, and going through all the paperwork can be challenging. You usually try and have specialist clinics for this sort of business, where you actually get the patient in. And so in the UK, what we often do is we have clinical nurse specialists who can sit down and go through lots and lots of detail and have extra time. So time, I think I've said 2 or 3 times now, and I'm probably wasting everybody's by doing that, but time is really often a huge problem for doctors, and that can also make the communication about trials harder. Having said that, I think one of the big problems is identifying who fits all the criteria, and then having that conversation with patients who may or may not be receptive to the idea. So it's a labor-intensive process, and each recruited patient is a huge boon to a trial, and that makes it worthwhile. But it is a labor-intensive process, and that goes back to that word I keep using.
I mean, I do think that's really good information, because I think sometimes we think, oh, if it's ready for a clinical trial, then like, let's just get to it. We can start tomorrow. But like you said, there's a lot of paperwork and then consent and, and understanding
Checks and
the
tests.
terminology, right?
Absolutely, absolutely.
So do you have like what kind of, I guess, feedback have you received from patients who have actually participated in clinical trials? I'd love to hear that.
Yeah, it's really variable. Some are absolutely delighted with the results. Some not so much, and the vast majority are actually just really excited to be part of something new. And I think that was what was one of the big surprises to me. And I think you just because you're a doctor doesn't mean you're not susceptible to the same kinds of biases as any other person, right? So I mean, I used to love watching television. I used to love watching TV shows like Scrubs and House and whatnot. And I had the same idea that you'd go to the clinical trial and you get this amazing new drug and everything would be awesome. And the patients were smarter than me, as they almost always are. And the almost is just a fudge for a doctor. They are so well informed.
Mhm.
And the vast majority of patients I came into contact with were just delighted to be part of finding out something new. And it wasn't really so much about getting access to something hot and new and exciting. It was being part of I think some were almost feeling that they were giving their disease process and their lot, there's really unfortunate lot in life additional meaning. And you see that all the time. And it's um, you sometimes get doctors waxing lyrical on in public forums, about the strength of their patients. And
Mhm.
it 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 really is true, even though it might seem trite to the cynical eye. You meet people who are having the worst time of their life, and they'll often think of other people in that moment, and that's really quite impressive to see. And so, seeing patients who are going through terrible diseases, and are still saying, you know what, actually, I want to make this worthwhile. I want to be part of helping the next generation, the next lot, so they don't have to go through the same thing. That's a really
Absolutely.
powerful testament. And you do see that all the time, and you see it in clinical trials, and you see it in completely different things.
Yeah,
Um,
I totally agree with that. It's like I have another friend actually interviewed her, Mary Claire, and she loved the idea of helping science, helping giving something to science, and possibly helping others down the road. So I think that's when you start to think of it as bigger than yourself in a sense. If you have to go through this crap, um, at least you're trying to help make it better for the next person.
Totally. That's,
Yeah.
I mean, amazing human quality.
What can we say? Wait, I'm putting myself in that, and I've never even had that conversation. But anyway, um, tell
You
me
should
this:
100%.